Hi, my name is Brittany Jennings, and today we're going to be talking about alcohol abuse in my persuasion speech. This is my father, Jeff, this is my friend Brantley, and this is my mom, Melinda. Now let's get into our conversation. Alcohol abuse is something that we as a community need to work together to help others stop. We need to go out and connect with others who are struggling with alcohol abuse and let them know that they are not alone and that there are multiple ways to reach out for help. It should be noted that alcohol abuse and addiction are not the same things. Alcohol abusers are not necessarily addicted to alcohol. Abusers do not care about the results that come from their drinking. Abusers may not drink on a regular basis. Abusers could only drink once a week, but during that weekly drinking session, they could drink to excess. And when a person drinks to excess, they can put themselves and others in risky situations and even drink enough to cause alcohol poisoning. The drug ethanol is more commonly known as drinking alcohol or just alcohol. Ethanol acts as a central nervous system depressant. There is a wide range of alcohol use effects based on the rate of ingestion, dosage, and the concentration in the blood over time. Short-term alcohol abuse varies depending on the amount of alcohol consumed. Short-term effects of alcohol abuse range from mild euphoria, balance and vision disturbance, and at high consumption levels, effects are severe loss of muscle coordination, unconsciousness, low heart rate, and loss of bladder control. Coma and death can even occur if too much alcohol is consumed. Long-term effects of alcohol abuse are chronic inflammation of the liver, also known as alcohol-induced hepatitis, which over time can lead to an enlarged, underperforming heart, alcohol cardiomyopathy. A less common outcome of prolonged alcohol abuse is the increase of variety of cancers. Aside from the personal health impact that alcohol abuse has, one must also factor in an increase of violence, crimes, and wrecks, cars or other. The economic costs of alcohol abuse are in the hundreds of billions of dollars. The United States Center for Disease Control and Prevention has reported that 90,000 people die annually from alcohol-related causes, placing it in the third place in the U.S. for preventable causes of death. Alcohol abuse can be deterred as an unhealthy drinking behavior. Defined as an unhealthy drinking behavior. This could be drinking too much at once or continuing to drink daily. Most alcohol abusers know what they are doing is detrimental to their daily lives, but it is uneasy for them to stop that habit. Alcohol abuse can result in alcohol poisoning. Symptoms of alcohol poisoning are unresponsiveness, mental confusion, repeated vomiting, and labor breathing and convulsions. It is important to seek medical assistance if you believe someone has alcohol poisoning. One reason stopping alcohol is a need is because when someone is impaired, they feel bulletproof and believe they can do anything. One issue is drinking and driving. A person who suffers from alcohol abuse has probably drove drunk at least once in their lifetime, but once is one too many times. In 2015, a rate of alcohol-impaired driving fatalities per 100,000 population was 3.2, representing a 65% decrease since 1982, when records began being kept. Abusers of alcohol tend to have trouble admitting that they have a problem and that they need help. One way to help a person struggling to realize is to have an intervention. Interventions seek to increase the alcoholic's desire to quit by confronting them with the effects of their behavior and actions. Interventions are most effective when it is close family members and close friends initiating the conversation. Seeking help can be hard for those who abuse alcohol. They may be scared of what will happen as they pull away from the grips of alcohol. After withdrawal and detox, a rehab program is usually recommended to help the recovering alcohol abuser adjust to life without alcohol. Depending on the case, the individual could do inpatient basis or outpatient basis with a program tailored to their specific alcoholic needs. Treatments can include counseling, addiction education, and a variety of therapies, including cognitive behavioral therapy. Even pharmaceutical or medical assisted recovery is an option. Aftercare and relapse prevention occurs after treatment. This could involve staying in a sober living residence, such as which some cities provide. Residents do not provide additional treatment, but they do provide a sober living environment in which addicts can provide help to each other. Support groups are easily found in communities. Alcoholics Anonymous can be a way to help stay sober long term. Regular meetings occur and are held nationwide. New Alcoholics Anonymous members get a sponsor, someone they can call at any time of day when they are feeling the need to talk or feel the need to drink. With all of the knowledge and the effects alcohol has, the actions that alcohol consumption can have, and even the recovery for alcohol abuse, I want you all to actually hear my words and go into the community or your family and help someone who is struggling. Some sufferers just need to know that they are not alone. We need to help eradicate the abuse of alcohol by having in-depth conversations with young kids and teens about the effects of alcohol. My sources were www.drugabuse.com/library/alcoholabuse and https://drugabuse.com get the facts on alcohol abuse, and https://www.responsibility.org. Thank you. I hope these words helped and someone you can help survive alcohol abuse.